Hello, my name is Kevin Bowman and I'm the Chief of the Department of Orthopedic Surgery. I want to take a moment to welcome you to Joint School. You'll have the opportunity to walk through the process of having your joint replaced here at Martha's Vineyard Hospital. Joint School will also give you the opportunity to see some of the faces and meet some of the people that you'll work with as you're recovering from your joint replacement procedure.
Hello everyone, welcome to Joint School. My name is Ian Campbell. I'm the Director of Rehab at Martha's Vineyard Hospital, and I'm here to walk you through getting you ready for your joint replacement. We'll be sure to go into great detail, step by step, to walk you through the process along the way, and hopefully we'll be able to answer all your questions as they come about. I'd also like for you to be introduced to your joint replacement team. Of course, you know Dr. Bowman, your orthopedic surgeon, Anthony Pyland, your physician assistant, Kirsten Gallery, physician assistant, Bryce Wilson, orthopedic nurse, Sarah Massey, physical therapist, Lawyer Resendez, occupational therapist, Patty Parker, your case manager. So everything that we'll kind of discuss today is we'll start from the very beginning of what your joint replacement will actually look like and what bones in your joints will be actually replaced. And then we'll make sure we'll go into great depth of preparing yourself for surgery, preparing yourself for home, equipment you'll need and things you'll need to pick up to make sure that you're set up for success once you are actually back home and functioning in your home environment. And we'll spend a lot of time kind of going from as soon as you walk in the door at the hospital, what to expect for check-in, and take you through that whole entire process of going underneath anesthesia, the surgery actual times, and leading all the way up to coming back up to the hospital floor and what to expect in your hospital room. And then going into details of, what will happen in terms of therapy, case management, and your whole process leading up to discharge and who you'll meet along the way. And then we'll kind of go into more detail of what your expected recovery times are and how long we'll kind of follow you for your whole joint replacement process and making sure that we're there to support you each step of the way.
Now that you've decided to have a joint replacement, I'm going to tell you what to expect. Most patients want to know what their new hip or their new knee will look like. For those patients receiving a hip replacement, it's made up of 4 components. We remove the arthritic portion of your bone and replace it with an acetabular component that has a liner. The liner is made out of a polyethylene plastic. The metal surface is made out of a roughened surface that the bone grows into. It's made out of a cobalt and titanium metal. The femoral component, after we remove the femoral neck and the arthritic head, we then remount the femur, and then we insert the femoral component, again made out of titanium and cobalt, and then we put on a ceramic head. After all the measurements are made and we make sure that the hip doesn't dislocate, then we go ahead and close up the incision and you're all done. For those patients receiving a knee replacement, which I like to call more of a knee resurfacing, it is also made up of 4 components. There's the femoral component, then there's the tibial base plate, there's the tibial liner, and then, which isn't shown here, but there's the patella, which is also made of a plastic polyethylene. All the materials are very strong and last a long time, sometimes 20 to 30 years. These are x-rays that show what your hip replacement will look like and also what a knee replacement will look like. These x-rays are taken right after surgery in the recovery room. The incisions for a hip replacement are as shown. We make a small incision on the lateral side of the hip, and then after surgery, we close that up. You won't see sutures or staples, and the knee replacement is as shown, and patients will have staples in the knee. Those are taken out after about 10 to 14 days after surgery. For the patients with the hip replacement, since you don't have any visible sutures or staples, you don't have to have any sutures or staples removed. You will see glue. We use a special glue to close the skin.
Hi, I'm Sarah Massey. I'm one of the physical therapists on the floor. So you've decided that you're going to have a hip or knee replacement. So things to think about before you even have your surgery is who will be assisting you at home. We normally recommend that you have someone there for the first week with you at home. They won't be assisting you in walking, but they will be assisting you in kind of general heavier chores. We recommend you look at your home setting, look at the hallways, see if a walker can fit down the hallways, remove any electrical cords, loose rugs, pre-prepare some meals in advance for before you have your surgery, and make sure you've got good lighting at nighttime. So equipment needed for post-joint replacement. You're going to start off on a walker. So you're going to be provided one of these at home if you don't already have one, okay? And then once you transition from the walker, you're going to be using a cane. If you look at the third picture on there, there's a commode, which you're going to be using, especially for the hip replacements. They have precautions that you can't bend past 90 degrees. So the raised toilet seat is going to help you maintain those precautions. The occupational therapists are going to provide you some equipment in hospital. You do not have to obtain these. These will be given to you. A sock aid, which will help put on your stockings and your compression stockings. The all-important grabber for picking up your equipment from the floor and maintaining your hip precautions. And then we also have a dressing stick. The occupational therapist will go through all of these when you're in hospital, so you don't have to worry about them. Other things that you might find helpful, as I said, for the hips, they have these hip precautions. So if you have a lot of lower seating in your home, you can get a furniture riser, which is the first picture on there. You can put that under the legs of any of your seats to raise it up to maintain your precautions. A walker basket is also handy. It's a basket that's just going to connect to the front of the walker for putting items in when you're walking about. Other handy things will be the grab bar when you're in the shower to make sure that you've got some security holding on when you're getting into wash.
My name's Bryce. I'm one of the nurses in the orthopedic clinic, and I'm going to let you know what you are going to need to do to prepare yourself for your joint replacement surgery. Leading up to surgery, we want you to get several good nights of sleep before the day of surgery, as you are going to be in the hospital for 1 to 2 nights, so it is important that you feel well rested going into this, as you may not be sleeping as well as you would at home. 48 hours before surgery, a nurse is going to call you from the operating room, and she is going to review all of your medications and your instructions before surgery and where to go and when to get there the day of surgery. The orthopedic clinic is there as well to make sure that you have any questions or concerns last minute the day before your surgery. We do want you to stay hydrated before surgery. There is a potential that you may feel a little bit dehydrated, so we want you to get a lot of water in beforehand. There is also a home exercise program that you are going to be doing to strengthen the joint going into surgery for the joint replacement, because it's important that that area is as strong as possible leading up to surgery. The night before surgery, there is going to be an anesthesiologist that will reach out to you as well as the operating room nurse. They are going to be discussing what medications you can and cannot take before surgery. We do not want you to eat or drink anything other than water after midnight the night before surgery. You are going to need to prepare your belongings, and I will discuss what you should and should not bring to the hospital. You are going to need to shower with this soap. It's called Hibiclens. This is a soap that you can get at any drugstore. We also have it here at the clinic, and you can stop by anytime before your surgery to pick this up. You're going to need to use this soap the night before and the morning of surgery, and you can use it on your whole body from the neck down. Items to bring for your stay. We want you to have underwear for at least a couple days, loose-fitting clothes such as shorts, t-shirts, sweatpants, and pajamas. You're going to need to bring comfortable flat shoes with backs, such as sneakers. You are also going to need your eyeglasses, your hearing aids, and any necessary personal toiletries that you could not live without for 1 to 2 days. You also want to bring any braces or orthotics that you normally use. A walker is also going to be important to have. If you already have a walker at home, then you want to bring that in the car and just have that already ready in the car on the day that you go home. Otherwise, as Sarah said, we will provide you with a walker. Please leave anything valuable at home. On the day of your surgery, nothing to eat or drink other than water, as previously mentioned. You are only going to take your medications confirmed by the anesthesiologist that you should be taking with sips of water. You will need to make arrangements in advance to arrive at the hospital 1 hour prior to your scheduled surgery. Again, an operating room nurse will let you know what time you should be getting to the hospital. You will need to report to the main lobby of the hospital for check-in and registration.
Once you've arrived at the hospital, you'll be greeted by the OR secretary and be brought over to the preoperative unit. In the preoperative unit, the nurses will greet you as well and bring you to your room. At the room, you'll change your clothes and you'll be prepared for surgery. The surgeon will come into the room and he will actually sign your hip or your knee or whatever body part is being operated on. That's a part of the safety protocol here at Martha's Vineyard Hospital. The physician assistant, myself, or another physician assistant will also greet you in the OR. We'll review your health history and ask if there's any changes in your health prior to surgery. You'll also be met by the anesthesiologist or the nurse anesthetist, and they'll go over any health issues and also talk to you about your anesthesia. Once that's completed, you'll be taken to the OR and you'll be transported by stretcher. And the OR team will also greet you and prepare you for surgery. Prior to coming to the OR, you will receive a light sedation to make you more comfortable in preparation for your surgical procedure. The surgical procedure will take about 60 to 90 minutes from start to finish. After surgery is completed, you'll be transported